listeners, James here from Dadvice TV, your online kidney health coach. And this is video number, holy cow, 93 in my journey from kidney failure to kidney great. And this is day 7 of Dadvice TV's Kidney Health Week, where every day we're bringing you helpful information to improve your health, to improve your quality of life, and to do what I like to say, kick kidney disease to the curb. Now, as kidney patients, one of the things we often overlook is health care. We focus a lot on our diet, exercise, controlling blood pressure, controlling diabetes, eating right, our renal diet, all that stuff. We are so focused on that, but we often overlook having a conversation about health care. Yeah, that's that extra help from the government when we go and we want to get things done, or when we buy something and we want the labels to tell us how much phosphorus is in there, for example. All of this is set by policies by the government. And we're going to talk about today, how can we influence people to do things that can help us as kidney patients to improve our quality of life, to better take care of our health. Now with me today, I have a great person. Not only is she a teacher, a lawyer, an advocate, but I consider her a friend. I met her not too long ago, had some conversations, and I was like, holy cow, she is a fountain of information. And she doesn't have kidney disease, but she has other challenges. So she's lived challenges that we have, getting coverage, making sure you're getting the best treatment and things like that. So let me bring on, we have Sara Bitter. Hey, Sara, how you doing?
Hi, how are you? Thank you for having me.
Oh, so glad to have you here. So tell us a little bit about yourself. I mentioned you're a mother and a lawyer, but I didn't say too much. So tell us a little bit about yourself.
Sure. I am a mom. I have 2 children that are living with a developmental disability, actually a genetic developmental disability. And I'm an attorney, and through my children and through my experiences with my family, I became what I like to call myself a disability rights advocate. So what I am doing right now with my background and with my experience is I have decided to run for the legislature in the state of Ohio, where I live. So I'm running to become a representative in the district, in the House district, in my community, and I'm hoping to become a legislator. Hopefully I'll win this seat, and I'll be able to go into our state capitol and help to write laws and policies that will hopefully make things better for families, for people in my community, but throughout the entire state as well.
Yep. And you have some political experience. Tell us about that.
I do actually. When I was younger, actually, ever since I was a little girl, or pretty much a teenager, I should say, I knew I wanted to become a lawyer. I had a lot of interest in law and in policy. And when I was in college at the University of Cincinnati, I had this really neat opportunity to do co-ops and then to apply for internships. And one of those internships that I applied for was at the White House counsel's office. For the White House. I applied for an internship at the White House. And this was in the 1990s. So this was during the Clinton administration. And when I actually got the internship, and I worked at the counsel's office. I worked in the lawyer's office of the White House. And after that internship, I came back to Cincinnati, and I had asked my boss for a reference, and they actually ended up hiring me. So my first job out of college, having studied political science, I worked in the West Wing of the White House, and I worked with the counsel's office under the Clinton administration. So it was definitely a time where I got to learn a lot about the executive branch and the legislative branch and the judicial branch all at one time. So that is my political experience before I went on and I went to law school and then had children. So this is my second experience with politics, I guess.
Yep. And what kind of got you to want to go into politics right now?
I decided that I wanted to go into politics now because I really am interested in I'm interested in public service, and I'm also interested in policy. After my children got older, as my children were getting older, first of all, I will say my kids have a genetic disability, so my life was spent getting a diagnosis, going through the challenges of learning what that. First of all, figuring it out, which took forever, for years, to go to several doctors and therapists and just trying to sort out what in the world was going on. Lots of tests, lots of hospitals, you name it, we did it. And then navigating health insurance and will health insurance cover it? What kind of therapies might be helpful?
Hmm.
But we went through that experience, and then going through education and trying to get my kids in the schools and getting the therapies that they needed. But as time went on, I started to really try to hone my legal background and my professional background and learning about disability policies, healthcare policies, any kind of large scale systems and policy information I could learn. I learned about it, and I actually went to I went back to school. I went to a program. It's called the LEND program, Leadership, Education, and Neurodevelopmental Disabilities program, and it's at Cincinnati Children's Hospital and at the University of Cincinnati. And so I went through that program and I just learned so much, even more than what I had known before about policy on a state, local, and federal level. So when after the last in 2016, I just decided that I was worried about healthcare. Really, I was worried about pre-existing clause being taken out of the Affordable Care Act, and some other things. And I decided that I really have, if not me, then who? I have a really good background and understanding of law and policy, and I'm really passionate about helping families. So that's what drove me. That's what made me decide to run for office. And I always tell everyone that my ultimate goal and the thing that drove me into wanting to run for office is I want to create something in the legislature in Columbus. I want to create a caucus or a work group that's called I would like to call it a disability, mental health, and addiction caucus. And it would be like a work group. So this is just a passion that I have. It really comes from my personal and professional experiences. But really, it was one of those moments where I just said, if not me, then who? Who will do it?
Yeah, and I'll tell you that family experience that you've had working with insurance, trying to figure out, is it covered? Now they have pre-existing conditions, going through all that. So many kidney patients out there have the exact same challenges and things to overcome. Now, when you and I talked earlier, I was asking, hey, does who we elect really matter when it comes to things like healthcare and all these issues that we have? And can they really, this is a question for you now, can someone we elect really make a difference?
Absolutely, absolutely. And another reason that when I was trying to decide to run for office, I sat down, my husband and I talked a lot about it. My husband is also an attorney. And I talked with my family and my friends. And honestly, having a person run for office, and then talk about issues, it gives you a chance to try to make change as you go. And so first, I'd like to just say that if we as people want to see change, then we have to be that change, right? We have to be the ones to make that change. And so just the act and the process of me running for office, it doesn't have to be running for office, it could be anything that you're doing, but also using that particular moment to talk about the issues is something really positive, I believe, and it moves things forward. But yes, absolutely, it can make a difference. If while I'm running for office, I'm informing and educating other candidates who are running for office, I'm also causing everybody to up their game and to think about the policies that they're not thinking about that are really impacting families and people, right? But then getting in there, I know from my personal and professional experience, and even from running for office now, that these issues, these healthcare issues, if we have, I use the word disability, but I could also say special healthcare needs. I could just say any kind of medical need, really. These matter, right? It makes such an impact in your life. And it is up to us as citizens, as community members, as people who live in a democracy to make sure our representatives are representing us And we make sure that they are doing the things and helping us in the ways that we need help. And the only way they can do that is if we let them know. And the way we let them know is by, first of all, people like me running for office. When we vote and we ask and we write letters and we say what we want, we say what we need, and we call our legislators. And that's how we do it. And absolutely, it can make a difference because your legislators, and you could choose an office, but in this instance, your legislators are the ones that write the laws and policies of your state. So they control insurance. They decide what kind of healthcare, how the healthcare system will run in your state. They decide really everything. And so, yes, getting in there can make a difference. And then us as citizens voting for people who know our issues is so important. And we need to begin the process of doing that more and more and more and more. And we have to push for it. And this is what I'm trying to do. I'm just trying to be a catalyst, right? And that's how the two of us connected.
Yep. And how, for everyone out there, you know, some of them are not here in Ohio, how do they find out which candidates are either fighting for the things that they care about? You know, when I heard you first speak, I was like, holy cow, you understand the challenges. I knew it right away because of your experiences. And when we talked, it all made sense to you. You were like, yeah, here's what we need to do, da, 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 da. How do others find out which candidates in their area are representing their voice?
Yeah. Well, the first thing that we all have to do, and I mean, even though I have a background in law and policy, I didn't know every single thing about every single elected official where I live. I'll be honest with you, I didn't know everything, and not a lot of people do. But the first thing we do is we learn who our representatives are. That's important. So we need to understand that every state has a House of Representatives and a Senate, not the ones that go to Washington, D.C., but the ones that are in your state capital. So that's the first thing to know. Just like we have a city council, we have mayors, that's the local, but we also have this in our state. And your state legislature is really, really important. So first you learn who they are. Then you can sometimes research to see which ones of those legislators try to focus in on healthcare. Like there's committees within your legislature. Who's focusing on healthcare? Who's on the healthcare committee, right? And then you might even just do like Google searches to see who cares about certain issues. You'll be surprised how much you can find out by doing things like that. But then the other way is you have to cultivate these people yourself, right? I know it sounds terrible, but you have to demand that they learn about it, right? That's what lobbyists are doing every single day, right? Paid lobbyists, like companies, corporations, they are spending millions of dollars to send a lobbyist into the office of your representative and my representative, and to teach them about anything at all, anything you can possibly imagine. They are teaching that legislator about that issue, and they want them to do something on their behalf. Well, we as citizens, as regular people, need to do the same thing, and we can do that. And that's what a legislature is supposed to do. So we can call them, we can write them, we can request a meeting. You will get a meeting. If you ask for a meeting with your legislator, you will get one. It is just, you're going to get one because they care about constituents. All legislators care about constituents. They have to. So the way we do it is we turn them into into policymakers that help us out. And if not, then we need to find the other legislators that do. Maybe that's their opponent, right? And then support their opponent, or try to help make sure their opponent can win, or we ourselves run for office, like in my case.
Yep. And when it comes to things like healthcare, I know a lot of people, at least here in the United States, you may vote Democrat, you may vote Republican. When it comes to things like healthcare, you know, I'm talking to everyone out there. We're kidney patients. We need to vote for whoever it is, whatever affiliate they are, whoever's working for our voice, the same message that we want, that's working for what we care about. Things like healthcare, mental health. That's another challenge for kidney patients. This is it's not a good diagnosis. There's not a cure. And stress, depression, a lot of other things are challenges for us. And a lot of people have trouble getting covered for the treatments they want. And I know, as you know, the drug companies are a lot of times pushing other treatments that make money for them. And with kidney patients, actually, I've discovered my own experience, and most people out there, the best solution for kidney patients is being healthy, working on your diet, working with a renal dietitian. These are things where there's not a lot of money in it.
Mhm. Yeah.
And taking less pills, but eating right, it could be better for you. And, you know, there's some groups, the pharmacies or the pharmaceutical industry, they may not, you know, support or push for those kinds of things. You know, they've got their agenda. So we need to pick people who are going to fight for us and that have the same desires as us, healthcare, things like that.
And I would
Now,
also just add that really what you need is you need people in office that will listen, right? That's the key. It's somebody that will actually sit down with you and listen, and then be a representative for you. So then take your voice and your wishes and at least advocate on your behalf. That's what we need. That's what we all need. And you're right, times are changing. We are trying to find, we might not have access to every type of healthcare that exists, even though we should keep fighting for it, by the way. But we might not have it. So what do? It's natural to try to do the things that can help improve our lives, like exercise, eat better
mhm.
food, do research, see if there are any alternative ways to help yourself that are positive and healthy, of course, right? Listen to your doctors, do the things that you're consulting always with your doctors, but find the ways to help yourself get healthy. And I would like to just touch on the mental health thing that you just said, if
Yeah,
that's
yeah.
okay.
Yeah, sure.
So, 1 in 5 Americans have a mental health illness or condition in their lifetime, right? So it's a big number. 1 in 5 of us will have some kind of mental health condition. So, anxiety, depression, it can be something like bipolar disorder and other types of disabilities, post-traumatic stress disorder. There's so many types. And I want to say that there's so much stigma and people don't want to talk about it. Younger generations are talking about it more and more, but we need to think about our mental health and how it impacts all of us, our health, our physical health too. And one of the goals that I have is to try to get mental health included into health education in schools. That's my goal. And some states are already doing this, meaning their state legislatures are already beginning to do this. And that's something that I have been doing just as a citizen, as a constituent, working on trying to get a bill passed in Ohio to make sure that children, when they're little, even when they're in kindergarten, all the way through high school, that we include the aspect of our mental health and well-being in when we're learning about health education, because it's part of who we are. It's not just our physical health. And then I would also like to say that you know getting help, getting peer support is really important for all of us. I had to go through that myself when my children were diagnosed. One of the biggest things that helped me was just talking with other people who also had children who are experiencing really big challenges, or other families that were experiencing challenges like my husband and I were. And it helps you feel like you're not alone, and it gives you strength, and it gives you it can help you feel much healthier mentally and mentally well, and it can help you just build your self-esteem and get and feel happier and feel joy. So I just wanted to say, you're not alone, and I know that you probably already know that, and I hope that you know that, especially when you first get that diagnosis. And I know I don't have kidney disease, but my children had very serious challenges when they were really little, and it was a really big challenge for my husband and I, and we went through a journey and a process. And now I've found my purpose in life, right? Now I've found my purpose. It's gone from complete, almost grief to purpose and passion, and I'm just driven, and I'm going to keep going and try to help as many people as I can. But I didn't start there, and it is a process, and that's okay.
Yeah.
So
And I'll tell
be
you, that is
mindful of
one
your mental
thing
health.
that you and I have so much in common. I was diagnosed, and it's a train wreck. Boom, you get hit by it. You go online. I'm doing research trying to figure out what it is. I'm like all alone. There's really, you don't have people to go and talk to. It's you,
Mhm.
you know, who else around me that I know of had kidney disease. So I felt alone, and I took that and I turned it into a purpose. And that's what started Dadvice TV. And
Mhm.
that support you talk about, that's what our community has. We support each other. We,
Mhm.
when someone says, hey, I'm having a difficult day, they know they can lean on us. And we've all been there. And, that we are so similar in that this is my life,
Yeah.
helping spread awareness of kidney disease, helping people improve their quality of life as much as possible, encouraging them to be an active part of their life, talking to their doctors, voting for people who will put our voice at the head of the line, and keep things in healthcare, working with insurance to make sure we're covered and we have the things we need. And your mention of trying to get understanding of disabilities and stuff earlier, and handling depression and all that. Those are all things that we've all had to face, and we didn't have the skills. And I've had so many people who send me a message. They just got diagnosed that day or the day before, and they're totally lost. And if they could have had, and some of them, some of them are in a very, very tough spot, and they might be thinking of doing something not best for them. And if they had that education earlier, they'd probably be in a better spot today. So I definitely agree. We need that as part of the basic education we all get growing up.
Yeah.
How to handle stress, understanding how to recognize depression and things like that, and a bit of understanding on how to do it.
And understanding that, disability, illness, all of the things that happen it's a natural part of the human experience. It's part of being a human being. And it's something that if we can support each other and get interventions and get help, we can get better and healthier and have good lives. We can.
Yep.
And that's the most important thing, is to know that it can get better. You can get better. You can have a good life and a good and happy life, and you can have joy and purpose, and there's positivity in it. But it is so important to get that, to find the people that are going to be your helpers, right? The people that are going to help you, like coming on your show and just watching and being part of that group just to kind of get you through, at least to get you through at the beginning, and then you keep branching out and building from that. It's so important. And health policy, insurance, all of it is determined by your legislature. So whether it's your state legislature or your federal legislature, these are the people we elect. It's up
Mm-hmm.
to us. It is absolutely up to us. We sometimes forget that because it feels so overwhelming and impossible to change. But that's why I'm running for office. I want to just teach voters that collectively, if we can get all the patients who are aging, who have Alzheimer's and Parkinson's, let's say, and their families, and then kidney patients, and then parents who have kids with Down syndrome or autism or cerebral palsy, or veterans who are coming back from war with injuries, or police officers. If we can get us all together, and then we can collectively say, this is what we need, because we all need very similar things,
Mm-hmm.
right? We all need healthcare. We all need everyone to be able to get the healthcare they need. We need to be able to keep our jobs, live in our communities, take care of our families, have a good life, right? Have a regular good life. That's all we're asking for. But we are very, very strong in numbers. We're strong if we come together, and we all need to realize we just have to get out of our silos and come together. And that's what I'm all about.
Yep. Now, when someone finds someone who is running for office that we're like, that is the right person, what are things we can do to help them, be better known, so people know that they stand for the things I care about, so that hopefully they'll vote for them. How can we help them get elected?
Well, the candidates always really appreciate it when nowadays, most candidates will have like a web page, they'll have social media pages. They have ways that you can connect with them. You can like their pages, you can go onto their website, sign up to volunteer. If there's somebody in your community, that's always a really good way to help them. Most candidates, depending on what they're running for, usually they need volunteers. They need people to put up a yard sign in their yard, or they need definitely people need donations, right? Individual donations, even $5, $3 is really helpful for people. We used to do a lot of canvassing. We called it canvassing, where we were like going to people's and knocking on their door and saying, "Hey, will you vote for, your candidate?"
Mm-hmm.
You can help them by volunteering. That's a really helpful thing to do. You can tell your friends about the candidate that you like. You can share your stuff on social media, but that's how you help candidates. They need volunteers, or excuse me, good candidates that you like. They need people to support them on every level, and you just plug in where you can, right? I mean, I have volunteers that help me write postcards. We write postcards sometimes. I have some volunteers that make phone calls for me. Sometimes they host like an event for me. It depends. I mean, we're in COVID now, so things have changed a little bit, but obviously. But there's lots of ways you can get involved in a campaign, and you should do it on a local level. Like, get involved in your city council races and your judges and your local state or your state legislative seats, like your House and your Senate. I, of course, want you to get involved in your congressional seats and in Senate too, on the U.S. level, and presidential even. But look at the people that are running for trustee and school board and all the other lower down the ticket. They usually say the bottom of the ticket type candidates, because these are your local community leaders, and you can help them to even shape them and what they care about. So that way, when they do work their way up the ladder, they're really looking out for for the interests of you and your family. So that would be how I would say. And I'm doing a collective, you choose your candidate that you like. Obviously, for myself, all the things I just said to you, of course, you can do for my candidacy. But I really am a team player. I want to see candidates talk about this stuff. I don't care what
Mm-hmm.
party you're from. I mean, this is why I'm doing this. Whatever your party is, please pay attention to healthcare. Pay attention. Don't take away the pre-existing condition. Don't come up with a healthcare plan, or don't get rid of one plan until you have another one in place.
Mm-hmm.
Because wow, what would that do to all of us? I mean, anybody. I mean, my family wouldn't get help. We wouldn't get health care, right? Neither would a lot of the people on this call. We can't do that.
Right. We rely on that, and healthcare has gotten so expensive that without these policies and insurance and all that, it's already difficult to afford it. It would become impossible for many, many people.
Yeah. And, it's extremely complicated. And I think that sometimes it's left complicated on purpose so that we don't, as voters, maybe understand it, because it's harder for us to advocate when we don't fully understand it. So I also try, as a legislator, my goal would be to be in office and to try to explain really complicated things in a more simple and easy, plain language way, right? That's more accessible for everyone. And that's what our legislators need to do too. They need to make information accessible so that we actually know what you're talking about, right? Which is a really hard thing to do. It's actually very hard to take complicated information and make it easy, but that's the right thing to do. And that's what we should be doing.
As a matter of fact, that's exactly what I do. We've had a few doctors, nephrologists, kidney specialists on who are good at talking to us, but the majority of our doctors, it's way over our head. We don't understand it. It's too complicated. And for most kidney patients, when we don't understand it, well, we can't execute on it. So we don't know what to do. Then we're not getting better. We're getting worse. So I, through the videos here, I try to take my journey and make it simple. And we've found a number of doctors who do that. And when we hear them talk, it just clicks. It makes sense. And it's so much easier for us now to do the right thing when we understand it and it's not being sent over our head.
And I know that too. I do family support for parents and families who are getting a diagnosis. And when you're in the moment and you're having a really challenging period, it's hard to remember information. So you have to be really, calm about it, but very clear and simple, and just consistent about the messaging. And you have to say it a lot. You can't just assume the person remembered it if you said it once, twice, or even 3 times. Sometimes you need to repeat it and have it easily accessible. And that is something, those are just basic things that policymakers don't have to do. Any one of us can do that, right? Don't assume that anyone knows that they know what you're talking about. Just assume they don't, right?
Yep.
And most people feel very embarrassed to ask questions. We shouldn't feel embarrassed to ask questions, but we do, right? We don't want to come off as, seeming like we don't know what we're talking about. So, that's why I always try to explain things, even about policy, even though I know people know it. A lot of people know this stuff, but some people don't. I even say, I didn't know everything either. Of course I didn't. And I'm sure you didn't know before you experienced this either,
well,
right?
And when the first time I met you, it was at a local driveway meet and greet. We all were social distancing, wearing our masks. I learned a lot. And I thought, hey, I understand this. I've got a good handle on it. No, I didn't. So it's one of those, you don't know what you don't know. I thought I knew. But then after listening to you, and then you and I talked a bit afterwards, I realized, and I'll tell you, some of my misconceptions, who I voted for really didn't matter. That's what I kind of thought. Yeah, does it really matter? Can it really make a difference? And we started talking, and I started doing some research, and I'm like, holy cow, it can make a difference at the local level, and actually fairly quickly. It's not oh, I'll start the change and maybe my children will see it. It's like, I can actually see the change.
Yeah, and the local and the state races, the change is much faster because it's so much smaller, right?
Yep.
So you can make change a lot quicker in your state legislature. That's why it's so important. Yeah.
Yep. So it's important for us to find the right candidates who represent what we want, that can amplify our voice and our needs, but also important to vote. Now with COVID being here, things are getting a bit more difficult, and kidney patients, we have a great fear. We can't get sick. It's just not good for our health. Even just getting the flu or the cold isn't great for us, because your kidneys play a vital role in keeping you healthy. And just getting sick, then their function goes down, and some of us are a bit on the border, and it could be bad. Are there any tips you have for voting to help those that are a little worried about what they may be able to do here in the United States to vote?
Yes. Well, in the United States, you can request you can say it however you want: absentee voting, voting by mail. You can vote by mail. You do not have to go into a polling location. And I know in Ohio, we can already request, so we can fill out a form and we can request that we get our absentee ballot, I don't have to say the word absentee, just ballot, mailed to us. And then we'll fill it out, the ballot filled out, and then we send it in. That will be our vote. Now, if you go ahead and do that now, so if I fill out the form right now and mail it in to my county board of elections in Ohio, I'm in the Hamilton County Board of Elections. If I mail it in, they will, when the time comes, they'll wait until the beginning of October, then they'll mail me my ballot. So even if you send it now, it will then cause them to mail it back out to you. So I highly recommend, especially with the slow mail, potential slowness of the mail that we're worried about right now, that you just go ahead, if your state allows that, to go ahead, and most states should. I don't know every single state. Every state does it differently. But in Ohio, we let you go ahead and request your mail-in ballot, which means it's going to be sitting at your Board of Elections until it's time, and then they'll send it to you, and then you'll have your ballot, and you just vote, and then you mail it back. Some places have it so that in Ohio, for example, again, I can speak about Ohio. I can't say everything about every state, but you can drop if you needed to, and you didn't want to mail it in. You could drop. They have drop-off boxes and things like that. But just you can vote. You don't have to vote in person. But I want to say one other thing about Ohio. Mm-hmm. For people with some people with disabilities need to vote in person. They need to, because there are special devices in the building that they need in order to be able to cast their ballot. Okay, so this is part of the Americans with Disabilities Act. This is part of voting protection for people with disabilities. So if you have a really significant health care concern, I know in Ohio recently, they let people go into the building like at a scheduled time so that there wouldn't be so many people there. Mm-hmm. So you could reduce the risk of getting ill. So please know, if you have a health concern and you don't want to do mail-in, or you need to go in, you call your county, you call your Board of Elections, and you ask them, what do I do? How do I do this? In every state it might be differently, but they have to accommodate you. They have to make it accessible for you, and you have that right. So please do that.
That is awesome. Yes, that is the most important thing, to vote. We need to vote. Figure out, look at what issues they stand for. Find the ones that stand for what you care about. Healthcare is extremely important to kidney patients, and make sure you do vote.
Usually your League of Women Voters or someone will have a voter guide, and it'll explain to you all the positions of all the people that are on the ballot.
So if we have a question here, actually, let's see. How do you provide the resources to support your policies to reach your end results?
Well, policy is decided, it's law, right? So just like any other legislature in any state, the budget is the budget decide, you pay for, you create a budget, a legislature creates a budget with the governor, and that's how it's funded. So that's how all policies create, how it's all funded. So that's why they say, if you want to see the priorities, this is another little tip for all of you. All of the anyone who advocates, let's say, for healthcare, let's say you are there's a kidney foundation that really cares about making sure that kidney patients are looked after in the legislature, and the laws and policies are protecting you, right? Mm-hmm. When the budgets are created, the lobbyists for that organization will be sitting there poring over the budget that the governor of that state has created. And they will be looking very closely to see how money has been allocated. You look at your budget to find out where the priorities are. And that's how you find out. So every state has a budget. Obviously, we have budgets. We get funding in our states from the companies that are in our the business that occurs in our state. We're all taxpayers. All of us pay money. I pay taxes. I pay health insurance. My family, we pay for our health insurance. We have jobs. We pay Social Security, and all of this money goes into our state and federal and different levels. And that is how budgets are created, obviously. So if you want to find out where the money comes from, you got to look at your governor's budget and determine where the priorities are. And that's another place you can look. You can see where people's priorities are.
Yep. Oh, that is great. So what we've kind of talked about so far is, this is an election year. There's elections coming up, and finding the right candidate and picking them. Say it wasn't an election year. Are there things we can do to raise awareness to our representatives about kidney disease, those that are in there? What are your tips to get them thinking, hey, I got to think about kidney disease. Let me do the right thing. And,
So what I would say is this, there's different ways you can do it, but individually you can begin you could individually contact your legislator and have an appointment and begin the process of educating your your legislator, right? The other thing you can do is sometimes people come together as a group. So let's say your group here decides to create a group that wants to do advocacy. You could have a day of action where everybody in, let's say, people choose, like 3 people in Ohio, let's say, and there's maybe some people in California and some people in New York, and you all come up with a way that on a certain day of the year, one day of the year, you choose a day that you're going to create appointments and go up to your legislature, wherever it may be, up or down, wherever you live in your state. For me, it's up north. So you create a day and then you sit down and you have meetings with them and you say, you all would collectively agree on what you're asking for. So let's say you want to find out what additive is in a type of food, let's say. And let's say in that case, you probably have to go to your federal, by the way. In that case, you probably have to go to your U.S. Congress. So you may have to call or even go to Washington, D.C., depending on, maybe you Skype with them, right? Or you do a Zoom meeting. But you collectively go and you say, all of you, and collectively you say, this is the legislation that we really think is important that you fight for us. And then they will all look at it. And let's say you reach 30, let's say it's a federal thing and you went to 15 states and you reached 30 legislators in the country, and you might actually influence them. Maybe they will look at your legislation that you're really you want to pass or you don't want to pass, and they may be influenced by you collectively. So you can do things just by yourself and try to inform your own legislator, or you can come together as groups, right? Sometimes, like, for example, I'll just choose, I won't, there are very specific nonprofit organizations that oftentimes do that. They look at policy, like the AARP, let's say, I guess that's an example, or let's say an organization for Alzheimer's or Parkinson's or MS. Like, they will get all of their members and they will all descend upon, sorry, my dog's in the room, will descend upon Washington, D.C. on their special day, right? And it's Alzheimer's Day, and they are going to go in there and they're going to meet with their legislators. And it's a really empowering thing to be able to have that conversation, and you're all doing it. And it really makes a difference. And I am sure that you may have something in the kidney disease field already. Yep. But if not, you can create one, right? Or you can create your own version of one.
Yep. And I know the American Kidney Fund is always lobbying for us, trying to get things changed. And one of the hot topics right now, you kind of almost hit it right on the head, is labeling on foods. For us, we really we need phosphorus labeled on there. We've got other things. We got calories, fiber, sugar, and things like that. But getting phosphorus added is very important for kidney patients, because it's one of those things we have to monitor every single day, how much we consume.
Well, that should be one of them. That should be the thing. You can have days of action where you are just getting every single person to write their legislator on that day, because they're the ones that are going to make that policy, right? They're the ones that are going to potentially influence the Food and Drug Administration to make a change, or your executive branch. But whatever the modality is, that's how you do it. And there are power in numbers. There are power. If there are any other groups that also have that food additive issues with that food additive, it would be a great idea to join forces with that group too.
Yeah.
Right.
Very good. All right. So we have been talking about 45 minutes right now.
Yeah.
If anyone out there has any questions, now today's topic is healthcare, how we can influence policy. We're not answering questions about nutrition or your renal diet or anything like that. But if you have questions, right now is the time to pop them into the comments on YouTube or Facebook. Why don't you, while we give them a chance, give them a little bit of time to type some stuff, because there's about a delay, about 30 seconds for them. Tell us a bit more about yourself, what part of Ohio you're running for, or you're running in, so those of us that you're on our ballot know.
Yes. I live in Hamilton County I live in Ohio. I live in Hamilton County and the eastern suburbs of Cincinnati. So I am running, we are expecting there to be about, let's say, 65,000 people who will vote in this election, and hopefully will vote for me, or not, well, they won't all vote for me, but will vote in this election. So I am in an area that has about 65,000 people who are going to vote. So it's relatively small. I am in, like I said, the Cincinnati area. And I know that you and I are actually almost neighbors. We live so close.
Yeah.
But I'm actually from Cincinnati. I'm from Cincinnati. So southern part of Ohio, southwest Ohio, Cincinnati, Hamilton County.
Yeah. Well, you definitely got my vote.
And eastern suburbs.
And one thing I think is really neat, even though it's kind of in a way a smaller area, it's not that small, but if we get someone like you in here at Ohio, you're equal once you're up there. You can bring up things. You can get the message out there. So it is important for everyone to vote.
Right. Yeah. We represent the people of our district as legislators, but we write policy for the entire state of Ohio. So a policymaker, a legislator, makes policy for the entire state. So we collectively, I mean, we represent a small part of our state, but we actually we represent our whole state, and we also work on behalf of all Ohioans, and that's the case. So I think I can make a really good impact, bring some subject matter expertise to our legislature, and really talk about some tough issues that I think our legislature could really use. And especially, I will say, I know we're talking about kidney health and I'm talking about different types of disability, but to me, one of the biggest areas is mental health. We really, really need to work on getting people to have, if you want to go to a therapist or a doctor, our insurance should cover that, right? We're paying thousands of dollars, potentially thousands of dollars a month for health insurance, and then our insurance doesn't cover health care, mental health care, right? Or we can't get a therapist, or it doesn't, and no one wants to go into a field where they can't get paid, right? Yeah. We should be able to, you want to encourage people to become psychologists and social workers and therapists and psychiatrists. We want to encourage health professionals to be able to get paid for the incredibly needed work that they are doing right now. And right now there's a barrier in health insurance, to be honest with you. And again, we're paying for our health insurance. It's not like this is a contract with our health insurance company. Like, I pay money. This is what I need. I want it to pay for the things I need, not for the things I don't need. Right?
Yeah. And we run into a similar issue as kidney patients with renal dietitians, a dietitian who is specialized in kidney care. Many of the times that's not covered by insurance. And a renal dietitian can be the difference between appearing normal, going to work, having a job, having lots of energy, and going into a dialysis center and being hooked up to a machine for 4 hours a day. Yeah. Just a little bit of time with that dietitian. But insurance makes it harder, so we have to reach in our own pocket to pay for it.
Right. Ultimately, that's what we all want, right? We just want to live our lives, have a job, be contributing, tax-paying members of our society, have a happy, healthy life with our family, travel, do the fun things that everyone likes to do. But we need health care. We need to stay healthy.
Yep.
And we're paying a ton of money for it. So why are we not getting what we need? And we voters, guess what? We gotta fight for it, unfortunately. And when I say fight, I mean vote for it.
Exactly. And getting people who will voice that we need this, that will stand up, that will fight for us in the local government and in the larger overall government.
Yes.
All right. So we got a lot of questions, but they're all kidney related. So they don't fit the topic right here.
Well, then
I'll go back and respond to those after it.
Okay.
because I don't want to bore you with all this weird technical stuff and blood test and things like that. Is there any last things you want to say while we're still here on the call to everybody?
Well, maybe I could ask you a question. How about that?
Yeah.
Okay. So why don't you tell us what's the most impactful thing that you learned that you can share with your viewers that has helped you through your experience? Because you've taught me so much just in the time that I've known you. I feel like you've really changed the way I understand things, and I feel like I'd like to see if you could answer that for me. Like, what has shaped you? What's been the most impactful thing in your experience so far in this journey that you can share?
I get a little wordy, so I might get. It's going to be a long answer. First of all, getting diagnosed with kidney disease is no one wants it. There, you do a Google search, it's all doom and gloom. I mean, they're talking about things like life expectancy, 3 years, blah blah. All that stuff's BS. It's not real, but it's all out there, so it's scary, and we feel alone. We don't know what to do. But the one thing that really helped me the most, I'm thinking of two different things. It really comes down to I didn't understand health. I thought I was eating healthy, I knew I was overweight. I knew I was very overweight. I didn't realize what it was doing to me, but the thing that helped me most was actually learning about how the food I eat, how my body uses it, and how to eat healthy. That was the thing that helped me the most. Now, learning how to eat healthy is not easy because, first of all, our foods are packed with preservatives. They're the cheapest stuff. They're highly processed. These are all things that are unhealthy for us. And when kidney patients, when we get diagnosed, first of all, it's hard for us to understand what the doctors are saying. They're using big words we've never heard before. The first time I heard renal failure, I'm like, renal? What the heck is a renal? It's another word for kidney. And a nephrologist, I couldn't pronounce those names. But they talk over our heads. We don't understand what they're saying, and they're trying to give us advice. We're in denial. I was in a lot of denial in the beginning. I was like, my kidneys are good. You're wrong, doc. Those blood tests aren't right. I was taking Pepto. I think it got my labs off. But the doctors, once I found some who could talk to where I could understand them, not talk over my head with all this medical jargon, who weren't looking at, okay, here's what we're going to do. We're practically going to put you on life support. That was the goal that the first one wanted. We're going to put you on dialysis. Life as you know it, it's over. Your job? Nah. All those things you've built up over life that you saved up, they're going to go away so you can afford to get on Medicare to pay for healthcare. But once I found someone I could listen to, and I learned that the importance of eating healthy and how to eat healthy. And to be honest, it's not hard. It is shockingly easy. It all comes down to portion control for kidney patients. We need to know what is in our food down to the nutrient level, maybe even the micronutrients at some points. And we have daily targets, a minimum we need to keep us alive and a number not to exceed. And we just eat and stick within that and be healthy as much as we can. And that has saved me from going on dialysis, losing my job, or even death if I didn't go on dialysis. That I was given 45 days. That was the original diagnosis. You need dialysis, you need a transplant, or else you got 45 days. You won't be here having this conversation. So that's kind of a long way to answer it. I learned the biggest takeaway, portion control. And by portion control, I don't mean don't eat this much food, eat this much. It's how much of an orange can I eat? How much of an apple can I eat? How much of a piece of chicken can I eat? Those portions with kidney patients matter. And that's where we're tracking phosphorus, potassium, calcium, fiber, sugar, there's a whole list. The vitamin D, our B vitamins. We need to know what exactly is in there. And then there's some vitamins that we can't get rid of that build up, and we could have calcification, where the calcium is pulled out of our bones and it hardens in our arteries. And if that happens, there's all sorts of other issues, heart issues, plus then you can't get a transplant. So that's kind of the takeaway. I learned how to eat right. And a long way to get there.
And I don't know how much time we have, but I have to ask you one more question.
I have endless time.
I do think that we're going to have some legislators watch this. I think we're going to have some policymakers watch this, and some people who are running for office, with some people who are in office. If there was one thing that you could ask, that you need, that you could advocate for,
I got
the
it.
sky's the limit. Ask the question. What would you like?
It is so easy. So the biggest problem, the biggest problem with kidney disease, first, it's a communication problem. We need to better train the doctors how to speak to us. Right now, they're so worried about getting sued or something like that, that they pretty much follow these old guidelines that are very outdated. They're not helpful, and we don't understand them. For the most part, every single person watching here who has kidney disease, their doctor told them, drink more water and eat less salt. Don't die. That was pretty much your help. How much salt? Well, if you go too low, you can have problems. How much water should you drink? More. You drink too much, you have problems. You don't drink enough, problems. But the one thing I wish was that they understood how to talk to us, that there was better training for the doctors to talk to us, and the doctors focus on sick care, not health care. That's their focus. This is broken. Fix it. The arm is snapped. Fix it. My blood pressure's crazy. Give me some medication to fix it. They don't work on preventive care. Every person who gets diagnosed with chronic kidney disease, the first thing their doctor should do, no matter how little kidney disease they have or how much, is get them with the renal dietitian. It should be covered by insurance, and we get with them, we suddenly learn how to eat. We learn how to slow down or stop our declining kidney function, and sometimes, like me, even regain some of your kidney function. So my kidneys today are still as scarred and shriveled as the day I spent a week in the ICU at death's door, barely clinging to life. Same kidneys today. They're no better. But I've learned through renal dietitians how to eat better to not overburden my kidneys. And that has allowed them to better keep up with me. They're not perfect. My kidneys are probably functioning. My last, what's called a GFR, was 33, which equates to about a 29% of function. The lowest I had was a GFR 8, which is about 5% kidney function. That's you could die tomorrow type kidney function. Once I learned how to eat, I got up to GFR 33. My kidneys are no better, but I've reduced the burden on them. So now I don't have anemia. I have energy. I can go to work. I can pay taxes. I can pay for my health insurance. I can pay my mortgage. I'm a part of society. I, for all intents and purpose, am completely normal. Besides me constantly talking about kidney disease and getting ready to wrap my car when I get my new one in a few months to promote better kidney health, besides that, you couldn't tell if you saw me. So that's the one thing I wish would happen, that laws would get changed or policies would get changed so that every time a person gets a diagnosis of any kidney issues, they would be referred to a renal dietitian. Now, to add to that, one thing that makes it worse, the standard operating procedure is the doctor looks and goes, they've got some kidney disease. Their kidneys are starting to decline. There's really nothing I can do. I'm not going to tell them. And most people find out when it may be almost too late to take action, to change their lifestyle, to stop smoking, to stop drinking, to get some more exercise. And the benefits of early interaction are less diabetes, less heart disease, less high blood pressure. We are controlling our blood pressure. So it actually helps the pharmaceutical companies. I take my pills every day as prescribed. I don't miss a single one, because if I do, my kidneys can start declining. I have to keep my blood pressure under control. So it actually makes more money for the pharmaceutical companies now that I know the importance of taking the pills, not going like, oh, you know what? I'm going to take one every other day. That cuts the cost in half, which doesn't help you. So that kind of, I got him on my soapbox there.
Oh, but that's exactly that. But see that you just reached the point, which is to say that the preventative care, being able to get ahead of something, to get the early intervention, and you think about how much money and how many lives we could save and how many good outcomes we could have if we had those kinds of access to just basic, that's really basic healthcare and information, right? We can be healthy, but and we need our policymakers to be looking, they need to be fighting for us for exactly
Yep.
what you said. And it's so many other things besides kidney health. It's every type of illness, every type of disability, every type of experience. This is exactly what I want to go and do in the legislature in Ohio. I want to fight for these things, and I want to bring people like you to Columbus and to testify and to say,
Hey,
this
I'll
is
be
what we
there.
need.
You know
And
it.
you will be there. You're going to help me. And you're going to get them to pay attention.
Until my last dying breath, which I think will be a long, long time from now, I am going to fight for better health care for kidney patients and early intervention. It's so important. And also, we spend so much on dialysis, and not everyone needs to be on dialysis when they got there. They might have been able to delay it or completely avoid it if they just made simple, and they really are, simple lifestyle changes. Before all of this, I was so unhealthy. Every single meal, and everyone watching knows this, every meal I had a big old 2-liter of Dr. Pepper, guzzled it down. I ordered my pizza, 2 large pizzas for me and something for the rest of the family to split, eating it. I didn't understand. I was so unhealthy. And I was going to the doctor for blood pressure and stuff. But now I've changed my life. I'm so much healthier. I don't get sick as often. I got bad kidneys. The burden that I place on our healthcare system is much smaller now because of the changes I've made because of kidney disease. And chances are I was going to an early grave, even without kidney disease, with obesity, most likely heart problems and other issues. Actually, getting kidney disease in a way saved my life because it forced me to realize I need to change things. I got 2 little kids. I can't abandon them by letting my health go down the tubes and, passing away. So it saved my life by forcing me to realize I was on a wrong path. It was so easy for me. Now, for everyone, it's not. Some people have other causes for their kidney disease. They could have lupus or something like that. There's not as much they can do, but the majority of kidney disease is caused by diabetes, high blood pressure, and heart issues. Those are the number one causes of kidney disease. Those are all things we can address, which will remove the burden placed on the healthcare system, which makes us better contributors in society. We can do more. We can be here for our children. We can be here for our family. We're buying houses. We're buying cars. We're helping the economy instead of needing support. We can contribute and help others. So that's kind of my whole standing up on my
and that's
my
why
soapbox.
you and I connected. That's why the two of us connected, and that's why I'm on your show, because that's exactly what I'm advocating for. I just want to help people live their lives, have a job, be tax-paying contributor, tax-paying member of their community, that's contributing member, that's part of it, right? We want access. We just want to be part of it.
Yeah, we're not trying to take anything. I want to actually give more. Let me keep working. Let me keep paying taxes, paying my property taxes, buying stuff, helping the businesses and stuff like that. Let me keep doing that, Doc.
We want to travel. We want to go places. We want to do everything that everybody else wants to do, and have a job and have a purpose and work hard and do something really good for our community and for our state and for our country. And
Yep. And for
That's all we
those
want.
that need like dialysis or a transplant, if I was not on the transplant list because I used diet to improve myself and delay, just like I did, now someone who really needs that transplant can get it. I'm not cutting in line or anything like that. That's another reason. There's so much I could say about it. It's just there's so much goodness going forward by having better early treatments. It's not even treatment. It's really just working with a renal dietitian. If we got every kidney patient with a renal dietitian, there would be less people going to dialysis. Now, the dialysis centers might not be happy because they make a lot of money off of each person and they're popping up everywhere. But there's enough people in dialysis. They can make money off of that. But we would have less of us that are on the transplant list that perhaps didn't need to be on it right now. So if some kid who really needs it, I interviewed about a month ago a woman who just donated a kidney to a stranger, and it's going to get me all teary-eyed here. She discovers later it went to a kid who then graduated high school because she donated a kidney and saved his life. I don't want to be the person who takes that kidney from him, and when I didn't need to get one because I could have learned how to eat better and not be on the list for a transplant. If that makes sense, I hope.
Yeah.
Yeah. We have a shortage of kidneys out there. The earlier intervention, the less of us that are fighting for that limited supply. Let the people who really need it get a kidney.
Yeah.
So hopefully I'd answer your question.
Oh,
I could talk for
that's
hours.
really helpful. That's exactly what, that's what I wanted I want to hear that, I want to learn from you too. I want to learn about the issues and understanding what kidney patients need. I want to understand it. And that's the kind of, legislator that I would be. And that's why you and I connected.
Well, yeah. And when I heard
good.
you talk, you had that same passion. You're like, well, here's what we need. Da, 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 da. And this was like a month ago. It was probably like 92 degrees and sunny outside. And we're all out there with our mask on, but it was so riveting. And it's hearing that passion. And that's when I was like, holy cow. Not only do I need to vote for her, she's the right person. I was like, I got to get her on the show to talk to other people. They're going to love hearing from her.
Yeah. And I will say too, just another separate plug, every single state in this country should have a disability caucus. Every single one of them. We should have these work groups where people understand that will actually look at policy and look at it from the lens of people who are experiencing healthcare challenges. Can you hear?
Yep.
Sorry, I think it went away for a second. Healthcare challenges and who have a disability. And again, disability is a big word. I use the word disability, but it can mean a whole lot of things.
Yep.
So.
All right. It's been a little over an hour. I want to thank you so much for your time, Sara. It has been fantastic. And what is your website in case there's somebody who's local or just somebody wants to learn more and say, hey, Sara, you're an awesome person. I support you. What is your website?
Thank you. My website is sarabitter.com. So my name is, I do not have an H. So it's just SARA and then it's B as in boy, ITTER.com. So sarabitter.com.
Yep. And I've got a link to it in the description. If you guys are like, where is it? Just go down. It's in the description. Check out her website. She's also got a great video. You learn more about her family and her experience and everything. But I just want to thank you so much for coming here, sharing this information. This is very different than what we normally talk about. Usually we're having almost like a medical conversation about foods and labs and results and all sorts of stuff that for someone who's not involved in it, they'll be like, what the heck are they talking about?
Well, I thank you. Thank you for having me. And thank you very much for having an interest in this subject of policy and advocacy and understanding that we all have this opportunity. We have the ability, we can we can make an impact. And I appreciate you just taking an interest in my candidacy, but also just in the subject of advocating for better policy for all of us, because we really are truly in this group together. We're all in it together. So I thank you. Thank you for, finding your purpose and doing this amazing, truly amazing work that you're doing. And I know there's going to be so much good that comes out of what you do, and you're going to help so many people. So thank you.
Yeah, well, I definitely look forward to working together. If you ever have a question about kidney disease, boom, I'm your person.
Yeah.
And
then if I get in the legislature, wait till November. If I get in there, well, you'll know because you and I talk. But if I get in there, I expect you to, we're going to keep talking about these issues. So you'll have a representative that can absolutely represent your needs. So
yay!
That's me. I can do it.
All right, everybody, thank you so much for joining us today. This is the last of 7 days straight of live shows. I'll be taking a break. I will be back on Tuesday at 6 p.m. Eastern Time with our favorite renal dietitian, Jen Hernandez, and we're going to be talking about how to have conversations with your doctor about your healthcare. Pretty much that problem we talked about, how we don't talk the same level and they're going over our heads. We're going to talk about how to have a better conversation with them. Please share this video. Let's help get people aware of Sara and how important it is to look for people who represent our needs and to go out there and vote. All right. Oh, so we have a question. Sara, do you have a Twitter? Do you have a Facebook?
Yes, I do. And yes, I have Twitter, I have Facebook, and I should know my Twitter handle already all by itself.
And I will add it to the description after this, but if you know it, let everyone
Bitter
know.
for Better OH, I think. Let me see. I'm sorry. I'll tell you.
No problem.
So this is real, it's like the
and we
real
have
world.
so many thanks coming here from people.
Yes. That's so funny. So my Twitter, my Facebook, and my Instagram are just, it's Bitter with a capital BITTER, the number 4, and then Better, capital BETTEROH. So
Yep.
I always say Bitter for Better is my slogan. So it's Bitter, the number 4, Better OH. And that's it for every single one, for all my social media.
There we go. Follow her. Let's share the video. Let's help raise awareness of great people like Sara who are helping to make the world better for us and for everyone. All right, everybody. I will see you in the next video. Have a great weekend.